Hey, I'm Yuri, I'm a nutritional therapy practitioner, and today I wanted to share with you some of my clients' progress so you could hear what is possible for your health. And I help women with minimizing hair loss by figuring out what may be causing the hair loss. So some of her symptoms included losing hair after birth control, blood sugar issues, high stressful levels, along with candida issues. And I wanted to dig a little bit deeper about candida issues. If you're unaware, if you're experiencing an overgrowth of candida, these are some of the questions that you may ask yourself. So one is, are you frequently taking any antibiotics? Are you on birth control? Do you experience any chronic sinus infections that last longer than a month? Do you experience constant bloating, cramping, or do you alternate between constipation and diarrhea? Another question you may ask is, do you have white coating or other buildup on your tongue? Do you experience cravings of carbs or sweets during the day? Do you feel fatigue or tired? And do you suffer from recurring yeast infections? The other questions you could ask yourself is, have you experienced any joint pain or tenderness, mainly around your hips or your knees? And have you had any rashes or other skin reactions? And if you answered yes to these questions, then you may want to look into an overgrowth candida issue. And I'm going to share the progress that my client has experienced. She mentioned, first of all, her hair loss has decreased significantly, and stress has improved along with her digestion. She also mentioned she didn't realize that she started her period because she had no PMS. So all of these improvements are extremely great for her. So based off of her blood work, we saw she was experiencing stress by having elevated glucose and insulin levels. She needed liver and kidney support, and there was inflammation going on. So anytime you start working with me, we initially start with a blood work lab, and we'll discuss that more of how to work with me. So we started her on a foundational plan where we incorporated lifestyle recommendations, which she was already doing, but this can look like getting sunshine right at the start of your day, moving your body. This can look like walking after meals to help balance blood sugar levels. Another way to help your glucose levels is to add sufficient protein to your meals. So you won't be eating too much carbs. And you don't want to be eating too many carbs because carbs tend to burn off fast. So anytime you're eating, include sufficient protein and a healthy fat. We also went ahead and started supporting her adrenals. Since she's always on the go, we included liver and kidney support. Another important factor when you're dealing with hair loss is calming down the nervous system. So we used reishi because it not only helps your nervous system, but it helps modulate your immune system. The last support we added was to start tackling the overgrowth fungus/yeast. And this is how my process works. It's by first building up your body, refueling your nutrient deficiencies, and calming down your nervous system. Then we start to tackle the biggest hurdles your body is facing. This can include pathogens, infections, or fungus. And this is a step-by-step process, and over time you can experience the minimal hair loss, the less digestion issues, or minimal PMS. So if you would like to start working with me, I work with clients in a 3-month package, and my information will be in the show notes. And until next time.